Hi, I'm Dr. Bruce Marshall of the Marshall Clinic in Vancouver. Welcome to this week's topic, which will be materials are to use in restoring teeth. Most people don't know. Often when I sit down to chat with people about previous dental experiences and they say, I had some dental work done, and I'll say, well, what material did you use to replace the filling that was done? And they'll usually say white or silver. But there's at least 4 different types of materials that you can use to restore teeth, and everything has a pro and a con. So the most common materials that people know about, one of the main ones would be, traditionally would be amalgam fillings or silver fillings. And so those are the ones that you can see in people's teeth. They typically look dark. And the pros of those materials are really easy to do, quite inexpensive, fairly durable, and non-technique sensitive. The negatives are they contain mercury, so for some people that's a big concern. That's been a very hot topic in the past, and has been proven to be a big enough concern that the material's been removed from use in various countries around the world and that sort of thing. But it's been very difficult to prove how damaging that source and quantity of mercury can be, because it's just difficult to study living people in that manner. So we don't recommend replacing the fillings just because of that material, but if somebody had a concern, certainly we would do that. The other negatives are they don't help hold teeth together, so they're held in by mechanical retention. Literally, when they put in, you look at the material and tooth interface under a scanning electron microscope, there's a big gap there, and that gap fills in over the first day or so with corrosion products. So it's actually sealed by corrosion. And then the problem, though, is that the material tends to expand and contract more rapidly than tooth structure does. So from my point of view, it can place some internal stresses on teeth that aren't great for them. The other negatives are they're not aesthetic, so you can see them, and they have to be replaced. The average lifespan on those restorations, if you look at the literature, would be roughly 7 to 9 years, though sometimes they can last much longer than that. Next most common restorative material, certainly today, when people would like their teeth to look like teeth, are composite fillings or bonding. So composite is a material that's part glass particles and resin. Positives are looks really good, helps hold the teeth together, fairly easy to do, not too expensive. Main shortcoming of that material is that it's not as durable. So the average lifespan on those fillings can be 5 to 7 years, and although you can get some lasting longer than that, particularly if they're smaller restorations, that's a pretty common finding in terms of the durability being a limiting factor. The other materials that are available to restore teeth are gold and ceramic. Gold has been the standard long-term for dentists in terms of durability. It's the most durable material in terms of our historical perspective. You could often, if you replace a filling with a gold inlay, and you take good care of it so you don't get more decay, and the tooth is well supported, and you've worked out the bite, it could last forever. The Marshall Clinic's been around for a long time. The practice has been in existence for over 92 years, and in this practice I've had the opportunity to see lots of gold work, because that was what was done back in the day, and many times they look as good as they do the day they went in, and this could be 40, 50, or even 60 years later. So that's pretty convincing to dentists. The main shortcomings would be increased cost, 2 appointments, and you can see them. So not everybody likes to see the gold, but there are ways to hide it. The last class of materials would be ceramics, and ceramics are getting more and more popular. The technology is really developing rapidly in terms of its improved performance or physical characteristics. So the positives for ceramics are you can make it look just like a tooth, so it'll be pretty much virtually invisible. It's at least 3 times more durable than a tooth-colored filling, typically, and you can be quite conservative with it, and it has great color stability and better durability. The negatives are it's increased cost. You can do them in one appointment now. We have in office the CIRAC technology, so we can scan a prepared surface of a tooth, design a restoration, and mill it out of a solid block of material, which will then be extremely durable and look great. And the 20-year studies now are for these types of ceramic block type restorations are pretty much the same as it is for gold, so it's a really strong option for anybody who wants a tooth-colored restoration. Thanks for listening. That's all about materials. For more information, subscribe to us, and next time we'll talk about cracked teeth and how we think about and manage those. Bye for now.